All right, we're going to have some real girl talk now. There was a time when we would never mention the word thigh or breast in public. In fact, that's why we called chicken white meat or dark meat at the dinner table. The fight against breast cancer made it okay to liberate our chest, but there's still one part of a woman's body that has not been easy for women to talk about. Whether it's from childbirth or menopause, incontinence and dryness are issues that vaginal rejuvenation can fix, and the latest procedure can be done in just one session. Dr. Franklin Rose and Brooke Gary are here with Utopia Plastic Surgery and Med Spa. All right. Hello there, Dr. Rose.
Hi, Deborah. How are you?
Good. Okay. When vaginal rejuvenation first came out, a lot of people kept making it all about sex. And although there are issues that can impact someone's sex life, that's not really the main point here. And in fact,
yes, I brought this along, Deborah. This is the official newsletter of the American Society of Plastic Surgeons. And, you know, mommy makeover has long been done.
Yeah.
You know, breast, tummy, lipo. And now we have fabulous technology. We were the first provider in Houston to have this Geneveve technology, and our beautiful aesthetic nurse Brooke will tell us about it.
Yeah.
But vaginal rejuvenation should now be considered part of sort of a mommy makeover and all of our practices. This is a radio
the things that actually
frequency.
happen, just whether it happens from childbirth or just aging or menopause and things like that, really can be irritating.
Oh, well, it's quite irritating. Things that happen after postpartum, after babies, would be vaginal dryness, vaginal laxity, stress urinary incontinence.
When someone laughs, things can happen, right?
Brooke has treated many, she's our aesthetic nurse, and has treated many patients with this Geneveve technology.
Yeah. And Brooke, when women come in, first of all, a lot of them are embarrassed to really kind of talk about it, but what types of issues are they having that they just got to put to an end?
A lot of ladies come in with painful intercourse, a lot of dryness, and stress urinary incontinence is the main one.
Yeah, when you say stress urinary incontinence, like when someone might laugh or
sneeze, cough,
jump on a trampoline,
jump rope during exercise, anything like that.
Yeah, and it's not necessarily age related, it's just what might be happening at the time. You and I were both talking. I had a baby, it was 9'5". You had 2 kids, right?
I had 2, correct.
Yeah. All right, so with this procedure, the nice thing about this one as compared to some others, it's one time that you do it, basically?
Well, this is a one-time procedure. Brooke would tell us it takes maybe 45 minutes, and it's a radio frequency pulsing mechanism that it actually pulses 4 centimeters transvaginally, again leading to tightness, increased moisturization. It's part of our med spa side. You know, the plastic surgery side, of course. Well, we're seeing a video right now of collagen simulation and how the procedure works. But really, the plastic surgery side is surgery, obviously. On our med spa side, Brooke does injection work.
Just lots of procedures as opposed to surgeries.
Exactly.
Okay, so here it is right here, and I'm just going to tell you, I had it done. Okay, but because mama's in menopause. Okay, but anyway, it's very quick, and it's radio frequency.
Radio frequency, and then it's also cryogen cooled. Behind here, cryogen sprays, so the patient can never be burned, and it's very comfortable. You absolutely feel nothing.
I can attest. Yes. Okay, so it's a series of things you do when you turn on the machine. What are you looking at when you...
Correct. So on the screen, we have the treatment level, the remaining pulses. You get 110 pulses for a full treatment. It takes about 30 minutes, 45 minutes with setup. And you have the wand, and I mean, the tip is really small. This is the only part that actually treats. So you actually feel nothing.
Yeah, all right.
It's very comfortable.
Yeah. All right. And so somebody who should consider this is if you leak when you laugh or sneeze, we talked about that, experience dryness and pain during intercourse, or have decreased arousal or physical sensation. So how long does it take before you start noticing some changes?
You can possibly see changes in up to 3 to 4 weeks, but you maximize at 90 days.
Okay. And for you, it's like nothing's too embarrassing. You want people to come talk to you.
No,
you get it. You're
definitely.
a woman too.
We always put a questionnaire sheet inside of our paperwork for new patients, and that tends to open up the door for a conversation.
Yeah, all right. Dr. Rose, I also want to point out something else that you've done. I mentioned earlier the breast and the fight against breast cancer, the whole bit. You have the Holly Rose Ribbon Foundation, and what you have done with that foundation is women who had to have their breast removed, you've helped them rebuild those breasts, and for some of them, they don't care to rebuild them, they're fine. For others, they feel like it restores a little confidence.
Well, correct, Deborah. This is a foundation named after my sister-in-law, Holly, who fought stage 4 breast cancer for 15 years. But anyhow, we've treated hundreds of patients over these years now, charitable cancer reconstruction, or in some cases, maybe facial disfigurement, in some cases, bullying. So it's a charitable plastic surgery foundation. We've expanded our mission a little bit beyond just charitable reconstruction post-mastectomy, but it's a very nice complement to my practice. You know, people think, I mean, over these years, I've treated some very famous, some very affluent, but treating these patients gives you just a real sense of
sense of service. That's why you do it.
It's a privilege for me, actually, and so it's something I relish and I like to do.
Yeah, and you mentioned like the med spa side. So when you say med spa, that's when you can do all the things like the Botox and the fillers and all that type of stuff. And on the plastic surgery side, you do everything from head to toe. Mother's Day is coming up, and so when we say mommy makeover, like after you've had your kids and they're grown, right? When you say mommy makeover, what does that include?
Well, mommy makeover would generally, what happens is after 2 or 3 pregnancies, sometimes the tissue of the abdomen sort of stretches, sometimes there's muscle weakness, sometimes the breasts get a little misshapen, sometimes there's a little weight gain. So typically it would include liposuction, abdominoplasty, breast lift, or breast lift with implants.
And when you say abdominoplasty, a lot of times people say, if I can just get rid of the fat here and lipo that, but if the muscle structure has been impacted.
So what happens is patients get a diastasis recti or rectus abdominis muscle splaying. So, you know, people kind of walk around a little subconsciously, kind of holding in a little bit, but we tighten all these muscles, remove the skin, remove the fat. I mean, it's a procedure I've done on 3,000 occasions at least, and it's just very grateful patient group who, you know, you're able to restore. You know, these beautiful babies come out, but then the figure gets...
So all the kids in the family need to get together and get this surgery for mom. Right? We're just making us feel good again.
That would be nice.
All right, Dr. Rose, thank you very much.
Thank you, Deborah.
Thank you. All right, Utopia Plastic Surgery and Med Spa is offering $250 off one treatment if you book an appointment and mention Great Day Houston. For more information, call 713-622-2277 or visit plasticsurgeryrose.com, plasticsurgeryrose.com for the Utopia Med Spa services. All right.